Our next speaker is Theo Loftsgard. He's an acute care nurse practitioner in the Mayo Clinic Cardiovascular Surgery Department at the Mayo Clinic in Rochester, Minnesota. He's assistant professor of surgery in the College of Medicine as well. He has an MS in nursing, and his clinical interests include critical care, ultrasound, and research. Theo has been involved in publishing case studies and research on intubations, acute lung injury, ICU shift handoffs, and bedside ultrasound. He is currently working on research with delayed chest closure after open heart surgery. Theo recently became gold certified by the Mayo Quality Fellows Program. Welcome, Theo.
All right, thank you so much for having me here. And to everybody that stuck around for the last two talks. I have a passion for critical care, ultrasound, and as most of you found out, my ultrasound passion. The big thing with this talk that I want you to take away is the best thing that I've ever done is got ultrasound trained. I know I'm not talking much about ultrasound, but that's the one thing I tell nurse practitioners, and the ones that learn ultrasound, they come back and say that was the best thing that ever happened to me. So for cardiac surgery talk today, I kind of go into all the new things, the innovations that are coming out and becoming more relevant to hospitalists that are taking care of patients after these surgeries or after they're coming back to the hospital being readmitted. So my only off-label talk is about ECMO. I have a couple slides on newer things that came out with ECMO, but all ECMO is off-label use. Learning objectives, transcatheter valvular implantation, we'll discuss that a little bit. Ablations and then surgical treatment after ablations or when ablations don't work. We'll review techniques surgically about thrombolytic prevention. And then we'll understand some ECMO uses during cardiac surgery. It seems like it's getting a little bit more prevalent. And then our dreaded sternal wound infections. And then we'll talk about a couple complex cases after we talk about some of the other complex stuff. So I have got approval from all my patients to use their names in these cases. So the first one is Mr. Polar Vortex. We'll start right away with a case, which a lot of us are dreading going back to Minnesota, the ones that do. I think we're getting snow again right when we land tonight. So Mr. Polar Vortex is an 86-year-old male, history of COPD, a little bit of oxygen at home, and he has a problem with constipation. He comes in with some shortness of breath,